Hi friends, welcome to my channel I Academy. Today I have chosen a general topic to discuss with you, that's tips to keep your eyes healthy. Tips to preserve your ocular health. Eyes are a precious gift. We need to take care of our eyes to keep our world colorful and bright. In order to make you understand better the tips for good ocular health, I would like to set up an overview of what we are going to discuss in this video. Eating a balanced diet, following a good lifestyle, using sunglasses, preferably ultraviolet blocking, then proper screen use in this digital world, self eye checkup, when is to be done, how it is to be done, and how when to get a doctor eye checkup done by an ophthalmologist, then a list of don'ts and a word of caution. Balanced diet is very important as far as maintaining the overall bodily health, and all nutrients are needed to preserve good eye health, like carbohydrates, proteins, etc. But there are three nutrients which need special mention for which are very important for eye. These are vitamin A. Vitamin A is seen in sweet potatoes, carrots, pumpkins, spinach, and other yellow or green vegetables. And vitamin A is very important in maintaining the retinal health, helps us in visual processes. Then another is omega-3 fatty acids, usually found in salmon, nuts, cod liver oil. And there are antioxidants like lutein, xanthine, which help us in preserving the normal functioning of our eye. These are found in kale, spinach, eggs, or nuts. Maintaining a healthy lifestyle is important for the overall wholesome bodily function. And as far as eye health is concerned, regular exercise are very important. Proper sleep, uh, roughly about 7 hours a day for an average adult, is very important. And hygiene, ocular hygiene is very important, especially for those who are contact lens wearers. Then use of sunglasses is recommended if you spend a lot of time outside. Use ultraviolet A and B blocking. If you are a digital screen user, then use blue light filtering glasses. And if you are a machine operator or a factory worker or you play contact sports, you need to wear protective glasses, especially those made up of polycarbonate. Here a word of caution to those who are more than -3 diopter myopes. They should avoid these professions of machine operation or factory workers um, or playing contact sports, because their myope eyes, are more at risk of damage from even a trivial trauma. In this digital world, we need to limit screen use to less than 2 hours per day. Digitalization has led to an epidemic of computer vision syndrome. I already uploaded a video on computer vision syndrome and various methods to tackle it. And it's very important to properly use the digital screens, like maintaining an arm's length, using large font, using good contrast, adequate brightness, keeping the distance I already discussed at arm's length at least, and keeping your computer screen directly ahead, maintaining a proper posture. Use 20-20-20 rule. It is that after every 20 minutes of near work or digital work, you need to look away for at least 20 feet for 20 seconds in order to give your eye muscles time to relax, in order to get rid of ocular fatigue. Then an important thing is that you need to monocularly check your eyes by yourself every week. In this, you close one eye and check for distant vision, check for near vision, check for color saturation, check for any dark spots, and check how much brightness you are able to perceive. It's always important you compare one eye with the other. It will give you a rough estimation how your eyes are working. For example, looking at a red object, check for the red color first with right eye, then with the left eye. See if is there any difference. Then there are ophthalmological checking by an ophthalmologist. It can be 6 monthly, or it can be 12 monthly. 6 monthly in those who are diabetic, hypertensive, or on anti-tubercular drugs or anti-malarial drugs, amiodarone or oral steroids. And 12 monthly checkup is recommended for those who are more than 40 years or who have family history of ocular disease, especially glaucoma. Now we have enough talked about the list of do's. Now we will be talking about list of don'ts. The first and foremost will be avoid smoking. Smoking has been limited to many ocular diseases like age-related degeneration, cataract, etc. Avoid direct gaze on sunlight, especially during solar eclipse or lunar eclipse. Avoid looking directly on welding arcs or on bright lights. These are very damaging to eyes, and you definitely need to avoid such activities. If you want to look at an eclipse, you can use indirect methods of viewing the eclipse. Avoid over-the-counter drugs. Use especially topical steroid eye drops, and avoid eye rubbing. It's very imperative that you ensure proper storage of sharp items, inflammable items, and insecticides, because roughly 10 million mechanical or chemical or thermal injuries are seen all over the world. I hope you like this video on tips for healthy eyes. Give it a thumbs up. Do subscribe to my channel.